interest are in cardiorespiratory, neurological rehabilitation, orthopedic and sports-related injuries rehabilitation, and women's health. With these few words, though it is a very, very brief introduction of these eminent speakers, I'd like to hand over the session to Dr. Mujib to take us forward and advise us on the work-related orthopedic injuries and its management. Over to you, Doctor.
Thank you. Right. Good afternoon, everyone. I'm Dr. Mujib. We're going to talk today work-related orthopedic injuries and their management. As you know, in United Arab Emirates, most of the people are here to work, and unfortunately, many of us live far away from the workplace, and then they go to the workplace and do the work and come back. So many people live in a very hectic schedule, which leads to a lot of problems, health-related problems, mainly orthopedic problems. Being orthopedic surgeon, I end up seeing lots of patients having these work-related orthopedic injuries. So I thought we will make the presentation on this one to make everybody aware of this condition. So what is work-related orthopedic injuries? So this is not, we are not talking about the accidents at the workplace. We are talking about the patient developing symptoms because of their prolonged work or wrong posture like that. So these orthopedic work-related injuries can involve either the muscle problems, tendon problems, joint problems, cartilages, and more common is the spinal problems. So many patients can have any of these problems. And like I said, this is not an acute injury. This is a chronic injury. It takes long time to develop because of our work, repetitive work, and posture. And most of the time it is related to the manual tasks. And there is a study which says that 30% of occupational injuries are related to these manual tasks. So we're going to go through all of them. No, that's moving. Okay, next slide. Okay. So what are the risk factors? Why we develop these work-related orthopedic problems? The most common reason is bad posture. So most of them, they assume bad posture at their workplace, whether their job is more office job, sitting job, or they're doing some machine fitting. Most of the time, the problem is they assume wrong posture during their work. So that's the most common for work-related injuries. The other reasons are lifting heavy weights, or their job itself involves manual lifting vessel, or if they are having repetitive activities, same activities multiple times, or if they are going to involve any vibratory tools. So vibration machines like drilling equipment. So all these things can cause some or other pains and aches to them. Apart from this one, nowadays it's all about the staffing issues. Everywhere there are job cuts. So less number of people will be doing more work. So when there is a less staff and the demand for productivity is very high, it leads to more strain on the worker. So that itself will lead to work-related problems. Again, how is the environment, the temperature? If you are working in a very cold weather, like in a cold storage, or if you are working in the outside environment, extreme high temperatures, all these will lead to these work-related problems. And at the end, what are the other factors? So whether the person who is doing the work, he himself is stressed out because of his family problems, financial problems. So mental stress, and if his fitness is not good enough, if he doesn't maintain a good fitness, that also can lead to work-related injuries. And work-related injuries are very common in smokers. So whatever the reason, the smokers are going to have more pains and aches. Whether their tissue healing capacity is poor or their attitude is bad, we don't know. But most of the smokers tend to do badly with these work-related injuries. So what are the warning signs? When will you know that you are prone to develop work-related problems, these orthopedic problems? Mainly, you feel aches and pains, which are not settling down even with rest or with medications, and you feel very tired. Okay, you feel stiffness in your body. Okay, and if you feel like you don't have strength, so all these things suggest that maybe you are not happy at your work. Maybe your work is putting too much stress on you. So once you get these things, you need to reassess your work situation and then work it out. What was the problem? The main reason for all the work-related injuries is stress. If you have too much stress, whether it's because of the work or because of your mental condition, you need to address that problem. Until and unless you address the stress part, these work-related pains, aches will continue. Go to the next slide. So what are the most common orthopedic problems you come across due to your work? They are all more related to the spine or upper limbs. So that's the most common. Lower limb problems are rare, but more of spine, like neck pain, back pain. And when it comes to the upper limb, starting from the shoulder, you can have shoulder pain, what we call rotator cuff syndrome, or you can have elbow problems, which can be a muscular problem like tennis elbow, golfer's elbow, or it could be a nerve problem, what we call cubital tunnel syndrome. And also in the hand, you can have carpal tunnel syndrome, which is again a nerve problem, which can cause numbness and tingling in your hand. So apart from that, sometimes you can develop fractures, dislocations, and what we call heat stroke if you are working in outside environment. And in the spine, mainly disc-related problems like disc prolapses. These things are very common. So we're going to go through some of the most common orthopedic work-related injuries. So I'm going to describe them first, and then my colleague is going to talk about how you can manage those problems. So if you come across any of these problems, you can pay attention now. So the most common work-related injury is tennis elbow or golfer's elbow. This is a pain in the elbow. So either it could be outer side of the elbow, which we call tennis elbow, or it could be on the inner side of the elbow, which is a golfer's elbow. So basically, this is the pain because of the overuse of the forearm muscles. So the forearm muscles we divide into two groups. One is the flexor groups, which helps in the flexion of the wrist. The other one is called the extensor group, which helps in the extension of the wrist. So because of our repetitive activities, which involves wrist motion, people tend to get pain around the elbow. So this pain is more common whenever you are making a fist, whenever you are trying to lift any heavy weight, you get a pain. Sometimes on the outer side of the elbow, sometimes on the inner side of the elbow. So again, the reason for this pain is muscle imbalance. So how we are going to treat this muscle imbalance, how you can avoid this pain, we're going to talk about it later. But this is basically a muscular problem. And it is very common. We see very frequently this condition. Coming to the next, the rotator cuff problem, also it presents as a shoulder pain. So here, if your job involves any overhead activities, like you have to paint something or you have to fit something above your head, or if you have to place some stuff multiple times above your head, so you are lifting your arm above the shoulder level. So when you are lifting the arm above the shoulder level, like you see in this animated picture, there are a couple of tendons which pass through the shoulder joint. So these tendons, they tend to rub against the bones and can cause inflammation. This is what we call impingement syndrome and also called rotator cuff syndrome. So this causes shoulder pain, and this pain is there every time you move shoulder and also at night time. So this is more common if your job involves a lot of overhead activities. So again, how to manage this condition? Again, this is a muscle imbalance problem. So there are certain exercises and there are certain preventive activities with which you can avoid this problem. Next condition is cubital tunnel syndrome. This is again another elbow problem. Here, there is a nerve, what we call ulnar nerve, which is on the inner side of the elbow, and it supplies the little finger and ring finger. That's the area it gives sensation and the movements. So these nerves go through a tunnel behind the elbow on the inner side. So if your job involves too much vibratory tools or too much elbow movements, that can cause inflammation of this nerve, that is lead to the pain and tingling in your hand. Okay. So that's cubital tunnel syndrome. It's a nerve condition. Next comes the carpal tunnel syndrome. This is similar to cubital tunnel syndrome, but this happens at the level of the wrist. Here, the different nerve is involved, which is we call median nerve. And this again, it passes through a tunnel, what we call carpal tunnel. And if your job involves again lot of wrist movements, especially if you are holding your hand in bent position, that can lead to compression on this nerve. And most of the people will develop the symptoms. The symptoms are tingling and numbness in your fingers, especially the thumb, index finger, and middle finger, and also achy pain. So sometimes patient has to wake up in the middle of night to shake his hand because the hand is gone numb. So that's the most common symptom with carpal tunnel syndrome. Again, there are some special splints we can use to stop these symptoms. So we're going to talk about it in the treatment. Next comes the most common problem because of this is the most common work-related orthopedic problem. I do see a lot of patients, at least every second or third patient is back pain, and most of the time it is related to the work. So what is the cause of this back pain? It's like I said, first, this is the poor posture. If you assume poor posture during your sitting or bending down to lift weights, or even if you are standing for a long time, if you don't assume proper posture, you are going to end up having the back pain. So the back pain, there are various reasons for the back pain. Why do we get back pain? It's multifactorial. So it's not just because of the disc problem. It can be a muscle problem, it can be a ligament problem, or it can be an injury to the bone, or your bone may be inherently weak, and it can be a disc problem. So there are multiple reasons for the back pain, and it needs really a good evaluation and a good training for you to avoid this back pain. Sometimes back pain patients can have pain radiating into the leg. That's what we call sciatica. Okay, that's because of the pressure on the nerves. So when the disc slips or when the canal becomes tight, what we call spinal stenosis, so you can have pressure on the nerve, and that leads to leg pain. Not only pain, sometimes you have tingling and numbness. That's what we call sciatica. So if you have back pain and leg pain, that needs more thorough evaluation because your nerve is also under trouble now. So sometimes we may have to do MRI scan, and then you may need a prolonged course of physiotherapy, these things. The Raynaud's phenomena, this is again one of the rare problems that can happen, especially involving your both hands. That's because of the reduced blood flow, decreased blood flow to your fingers. It does happen because of the alteration in the temperature of the working place. If you are working in a very cold weather, it is very likely to develop spasm in your blood circulation, and then you can have tingling, numbness, and pain in your both hands. Now, this is a special condition, what we call decurved stenosynovitis. This is the pain on the outer surface of the outer side of the wrist joint. So it's pain radiates from the outer side of the wrist along the thumb. With any thumb movement, you get pain on the outer side of the wrist joint. So what is the reason of this pain? Why do the people get this pain? This is because couple of tendons, they pass through a tunnel on the outer side of the wrist. So because of frequent movements of the thumb, that causes friction in the tunnel, and that causes inflammation and pain. And this is again a very common condition. It not only happens in workers, it can happen even in household activities like housewives. So, and again, the treatment for this condition, it involves giving the wrist splint support and analgesics. So this condition we're going to discuss in the treatment again. Now coming to the neck pain, again like back pain, neck pain is very common nowadays. The main reason for the neck pain is again poor posture. If your job involves too much desk-based job or computer jobs, so you are likely to have the neck pain. The neck pain, again, it is like a back pain, it's multifactorial. It can be coming from your muscles, ligaments, bones, or disc problems. Okay. So it can affect again, like in the back pain, you can get the pain radiating into your upper limbs, which is associated with tingling and numbness. So when you have the pain into the upper limbs, neck pain radiating into the upper limb, what that means is you have pressure on the nerves, in which case you may need further evaluation with MRI scan and may need interventions like physiotherapy and surgery. Nowadays, because of the frequent usage of the mobile phones, this neck pain is so common that even nowadays we are seeing in very young patients, even school-going children are coming with neck pain. So those are the various common work-related orthopedic problems we do come across, and most of them can be sorted just with the proper care of the posture and maintaining fitness. My colleague is going to describe the management. Most of them are preventive aspects. So if you concentrate on the prevention, that is better than the cure. Thank you.
Thank you very much, doctor, for explaining each and every orthopedic condition related to work in detail. Good evening, everyone. Assalamu alaikum. Now I will be explaining how we can manage and mostly how we can prevent these issues related to work. First of all, we have to do some control methods like we have to prevent these injuries initially, like methods for protecting against work-related injuries. First one is establish ergonomic program. Like there should be a proper ergonomic control methods at every workplace in order to prevent it at the initial level. And then training should be given to each staff on proper lifting, proper handling of the equipment, doing the work and job properly. There should be a good training given to all the staff. Feedback from all levels should be taken, like from the manager level, from the staff level, from the laborers, and all the levels. There should be a feedback if they are happy with their work environment or not, if the ergonomic they are adopting at work, it's done properly or not. There should be a proper feedback taken from each level, and they should also conduct job hazard analysis, and they should be given tasks and analysis should be done over that. And early recognition and reporting is the most preventive method that we can see, that if there is any hazard or if they have faced any problem at their work, it should be reported and recognized at the earliest level. So here you can see some examples of engineering controls, like how the engineering techniques can help to overcome the work-related issues. So workstation design and setup should be done. Like not everybody is fit to the work. For example, some of the bodies, like if you see in the first image, this person is tall, so this workstation is fit for him. But if you see the second image, according to his height and physics, this workstation is not proper to him. So he is using a stool under his feet. This is called ergonomic control. And then if you see the female, for her, different type of stool, like same stool cannot be used for same people. So different tools based on their height, how you can adjust to the workstation and perform your work easily. And also ergonomically designed tools should be used. Ergonomically designed equipment should be used, and load weight reduction techniques can be used. And even if you see in this picture, the third picture, they are using the rolling method in order to transfer the objects easily. If you see in the second picture, he is using a stool under his feet in order to adapt to the height of the equipment. And then there are certain examples of proper work practices. For example, how you can do proper lifting technique. Like if you are about to lift a weight, it shouldn't be like you are just bending over the weight all of a sudden. It should be like you have to go close to the object so that your base of support is within your center of gravity and the object is closer to you. So first of all, if you will follow the sequence of the picture, it will be easier to understand that you have to go closer to the object and then grab the object around your body. Plus, when you are bending, you have to bend your hip as well as your knee. Sometimes we see they are just bending the back, and this leads to mostly back pain. So bend your back, bend your knee, grab the object, and then try to lift it upward. It shouldn't be like you should not twist your back while lifting the object. Sometimes if the weight is heavier, it should be lifted in a sequence easily. And then you can also use the team lift. There should be a team when you are lifting the weight. And then you can also do stretching for your muscles before you start lifting the weight. Or there should be work rotations. For example, if a person is lifting or doing a task for say 3 to 4 hours, there should be a rotation. Like next person should come and he should do the task. Not one person is keep on doing the same task. He should be given proper rest at their workplace. They should be given rest and break during performing the tasks. And also you should use proper PPE while you are working. For example, some of the works require gloves, and all types of gloves are not the same. It should be different gloves are used for different works. For example, gripping works, for example, their work is to hold the object. It should not slip from their hand. They should use gripping gloves for that. And then knee pads, in case if their work is to kneeling, bending, and touching the ground frequent times. So they can use the knee pads in order to prevent the injury to the knee. They can also use vibration gloves, thermal gloves if they are working at high temperature in the industries and all, steeling companies and all. They can use the thermal gloves in that case. Lifting strap can be used in order to prevent bending more and more. They can use the lifting strap so that they can lift the object easily. Shoulder harness can be used to protect the shoulder, and lifting braces can be used as well. This comes all under PPE that can be used to prevent the work-related injuries. And now I will discuss some of the most common hazards that are present in our workstations. And along with that, I will give the solutions also, how we can manage it. So the first one is if you are reaching above your shoulder level. For example, if we see the maintenance team or some of the laborers, when they are working, they are going above their head level to fix the objects. So if they are working with their hands above the head level for more than 2 hours per day, it is a hazard. It is a hazard for their health. So how we can prevent this? This can be prevented by keeping the items close to them. They can remove the obstacles, and also they can use equipments to raise and lower the items. For example, if you see in this picture, the person is using a tool to bring the object down. And then in the next picture, instead of going taking the shoulders above their head level, he has kept a stool under his feet in order to reach the level of the task that he is performing. So in this way, we can try to prevent this issue. And then there are certain evacuate postures that we are adopting during our work. So if you are working with the neck or the back bended for more than 30 degrees, and if it is more than 2 hours, for example, if we see the receptionist or some of the call centers or people working with the computer, they are bending their neck most frequently. If it is bended for more than 30 degrees, it is considered as a hazard to their health. And the similar thing is for the back. So how you can prevent this is like you have to raise raise or tilt the work for better access, and use a stool for ground level works. As I will show you in this animation, the person is lifting the weight, but he is not bending down. He is using the correct posture using an equipment. So here the engineering comes into effect, like the equipment can be used in order to lift the weight. So as soon as he is lifting one cubicle, the other one gets upper with the help of the equipment. So we have to use proper ergonomic and engineering techniques in order to prevent these issues. And also, if you see the correct posture while reading, here you see there is issue with the elbow. So how we can prevent it? By keeping a pillow under the gird. And also there is an issue, if you see, the issue is with the knee. The knee should be at 90 degrees. We can keep any stool, any desk under the feet in order to adjust the height. So that your height should be adjusted while you are reading or while you are doing any computer work. And now correct posture while using the computer. This is mostly related to everyone who are doing the desk job. First of all, the chair height should be adjusted. And the chair height, it means like your back should be touching the seat, your feet should be touching the ground, and your monitor should be at your eye level, as well as the screen should be clear. Sometimes if the screen is not clear, people, they tend to move forward to read. Also, you can use glasses as I'm using to read it clearly. So this way you can prevent the hazards or injuries happening at workstation. If it is not monitored well, it leads to neck pain, it leads to back pain, it leads to your wrist pain, it leads to your elbow pain. So just a simple task, like you have to work, you have to sit properly while you are doing the task. Like your back should not be bended so much, it should be straight most of the time while you are doing the computer job. And also the keyboard height should be at your elbow level. The other hazard is a backward body posture. So if you see some people, their job is to do squatting or kneeling for more than 2 hours per day. If we go to the malls and all, sometimes we see people, they are bending to carry the objects, like bending or kneeling or squatting. This is also a hazard for their health. For a long run, it leads to injuries to their knee, to their feet, etc. So the solution is, like, you can use tools, longer handled tools, in order to carry the objects, and then they can also change their position, alternate position while bending, kneeling, sitting, squatting, all that they have to change the positions. It's not like they have to, sometimes we say like this is the correct posture, but not all the time one posture is considered as the correct posture, because in one say, we can say, in one sentence we can say like no posture is correct. As long as you maintain one posture for a long time, it leads to like fatigue of your muscles. So you have to keep on changing your postures whenever you are doing any task. And there is one more hazard that is called backward grips. For example, when we go to the bakeries or we go to the newspaper or stationery bookshops and all, some people, they have the habit of carrying the objects. For if you are gripping 10 or more pounds of force for more than 2 hours per day, or you are pinching the any object which weighs more than 2 to 4 pounds, or a force of 2 to 4 force, then for more than 2 hours per day, it is also considered as hazard for the health, because it leads to many conditions, like as Dr. He was explaining, decurrent stenosynovitis is one of the conditions that we mostly come across. Most of the patients, they have issues with their thumb because they are not holding the object properly, and it leads to their weakness of the muscles and poor grip strengthening as well. So how we can prevent this issue is like design work layout to reduce hand carrying. So instead of carrying the object this way, the person can hold it this way so that the object is carried equally in both the hands, as well as it is not giving pressure to their thumb. This is one of the way to prevent it. And also they can reduce the amount of items carried. For example, if the person is carrying 1 kg, or for example, if the person is carrying 5 kg, he can reduce the load. He can make it to 2 kgs, which is like easy for them to carry, and it will not be affecting the strength of the grip. And they can also use non-pinch grip postures. Instead of holding it this way, they can use some tools, etc., in order to carry it out, and they can use ergonomically designed tools, aids, etc. For example, if you see the typing posture, most of the people, when they type, they are following the wrong typing posture. They bend their wrist a lot, which leads to pain at the backside of their hand. Like if you see this aspect, the extensors compartment or the extensors of the forearm or the wrist, it leads to pain. And also they develop a condition called carpal tunnel syndrome, which is the compression of their median nerve. So the correct way is you have to keep your elbows straight while you are using a keyboard. And this can be done using any pads or any tools that you can keep under your wrist, and then you can use the correct typing posture. And there is also one other hazard called repetitive motion. So repetitive motion for more than 2 hours per day, it is also a hazard to the health. For example, some people, they are typing continuously for let's say 7 to 8 hours, they're continuously typing. Some if we go to some of the shops, they are just cutting the equipment, so they are keep on folding, repetitive motions they are keep on doing. It leads to hazard, it leads to inflammation of the tendon, ligaments, joints. It leads to inflammatory factors rises. So it affects their health. For example, if a person is doing this job for a day or two, it is fine, but they have to do 8 to 10 hours, and it's like their daily routine. So this repetitive motion leads to a health hazard, and it leads to pain and inflammation and cause issues for their health. So how we can prevent it? Like we cannot stop working, right? So we have to find some solutions to this issue. The solution for this is arrange work to avoid unnecessary motion. Like for example, you can keep the equipment closer to you instead of if a person has to carry the equipment or the things, or you can keep the things around you instead of going again and again and bringing the things back to you. You can bring the things closer to you. Let power tools and machinery do the work. You can use the equipment instead of using your hands manually. Again and again, you can use some technology. Now the technology is very advanced, so you can make use of the technology and make your task easier. And also spread the repetitive work out during the day. Instead of doing the repetitive work continuously, for example, you did the repetitive work for 1 hour, give rest for 10 to 15 minutes, and then you can repeat again instead of doing it continuously for 2 to 3 hours. And then take stretch pauses. You can also give break to yourself, as well as you can stretch your muscles, because the muscles, they get contracted with the repetitive task. You have to stretch your muscles while you are doing the work. It can be any work. It can be in the hospital setup. It can be in the company setup. It can be in the industry, in the farm, and anywhere, whatever work you are doing, you have to give break to yourself. You have to stretch your muscles, and you have to rotate the task. Like it's not like one person will keep doing the task again and again. You have to divide the work among your colleagues as well. And change hand motion frequently. If you see in this picture, like you have to change your hand posture. For example, this is considered as your standard area where you are doing the work. So you go out of your primary task movement, you go to the secondary task movement, and then you perform the work, instead of keeping your keeping yourself at the primary task level. So if you go to the secondary, it also stretches and leads to less pressure on your joints. And also you can use the teamwork and mechanical usage for repetitive tasks. For example, they are making use of the machineries in order to make the task easily. They are making use of many workers in order to do the work easily. It's not like one person is packing, lifting, handling. No, it's a teamwork, and there is a usage of the equipments, the mechanical tools as well. Localized pressure on body parts. This is also one of the common hazard that we have seen in our daily life. Many patients, they come, they say our wrist is like hurting, or our knee is hurting. And then when we ask, what is your occupation? Like sometimes we have to focus more on what is their occupation, because some of the issues are related to the occupational hazard as well. So if a person is using hands or the knee as their hammer, instead of using the hammer or the equipment, they are using it as a hammer for more than 10 times in 1 hour or more than 2 times per day, it is also considered as a health hazard. So how we can prevent this health hazard is by using the tools with longer handles and padded grips. The grips should be padded so that it does not cause pressure sensation on the joints. And also the handle should be longer so that the person doesn't have to bend so much. And they can easily do the hammer work or any other carpenter work, etc. And also another hazard is localized pressure on the body parts. Like for example, if you see most of the people who are doing typing job or who are working in the computer, they are pressing their body parts on the hard surface. If it is done for a day, it's fine, but repetitively they are pressing on the hard surfaces. Or if they're standing or kneeling for prolonged period, it also leads to the pain under the feet. Sometimes patients, they come, they say, we have pain under our feet. So it's like they're like, we don't know what's the cause. But when we ask, what is your job? Sometimes they say, we are working as security, or we are working as standing a supervisor, etc. So related to their work, they have issues under the feet. So how we can prevent these issues as well? There is a solution. They can use pad tables under edges or use tables desktop with rounded edges. So if you see in this picture, the girl is using the keyboard, but she is using a padded equipment under the keyboard. So this is leading to less pressure under her wrist joint, so it's protected and she can do typing easily. And then if you see in this picture, the person is standing on a comfort and anti-fatigue mat, so it will lead to less pressure on the feet. So also that you can use the shoe inserts or other items that reduce pressure on your body. There are a variety of equipments available in the market that you can use for different part of your body, for the knee, for the elbow, for the shoulder, wrist, back. Even while you are sitting on the chair, how to reduce the pressure on your like the coccyx. There are special Dennett cushions that can be used. So this you can use in your daily life in order to reduce the pressure on your different body parts and reduce the pain as well. So here, if I show you that design tools to reduce pressure on your body parts, like the person is using a flexible mouse, or instead of bending your wrist frequently, you can also bend your elbow. So instead of using one joint repetitively, continuously, you can use the other joint so that the load on one joint is relaxed. And instead of using, for example, right-handed people, they keep using right hand. You can shift some of the task. We know we cannot shift all of the task to the left hand, but you can shift some of the task to your left hand, so the pressure or the workload on your right hand is reduced. And also lifting objects. So this is like, as doctor was explaining, that most of the patients, they come, they have back pain. So why does this back pain happens? Because sometimes it is accidental, but most of the time it is related to their work. For example, if they are lifting heavy weights, if they are lifting frequently, if they are doing any backward lifting posture at the higher level, or it can be related to any of the profession. It can be related to the nursing staff. It can be related to the doctors, engineers, laborers, maintenance team, or any person who is working in the industry. When they are lifting an object in a wrong posture, it leads to back pain. Like as doctor he was explaining, there are different orthopedic work related issues that leads to back pain. So how we can prevent this? There should be a solution for preventing, because now we are not discussing the treatment, we are discussing how we can prevent. We want everyone to be living healthy. So first you have to plan the lifts. So first, when you see the object, it's not like you go, like I was explaining initially as well, that when you see the object, it's not like you have to just go and lift. No, you have to see the object, and then you have to analyze what is the weight of the object. If the weight is easier for you to carry, or you require help from your colleague or your partner. So first you have to analyze the object, you have to analyze the weight of the object, you have to go in the safe zone near to the object, go and grab the object, minimize the lifting distance, frequency and duration as well while you are lifting. And this will help you a lot in your daily life while you are working, in order to reduce the back pain issues. In this animation, just I wanted to explain, like this person, he just went in the first animation, he just saw the object, he did not analyze the weight, he did not analyze the height, nothing. He just bent from his back, and then it leads to back pain for him. But then in the second image, if you see, the object size is lesser, and then he is taking help from his partner to lift, and he is bending his hip as well as he is bending the knee, and the task is divided. So in this way, the back pain issues and lifting issues can be reduced. And the last hazard that I would discuss today is the vibration. This happens in frequent, in few of the situations, like some of the tasks that requires vibrating tools that they are keep on using frequently. So if they are using moderate for like more than 2 hours per day, it is considered as moderate hazard. High hazard is more than 30 minutes per day. If you are using a vibrating tool, can be any equipment, for example, vibrating equipments for drilling and all. If they are using more than 30 minutes per day, it is considered as a hazard. And if they are increasing the duration, it's considered a high hazard. So what can be solution to this? The solution for this is simple, that they have to use low vibration tools and devices that may reduce the vibration. Now the technology has become very advanced, that they have started using the tools that gives less vibration. The task will be done, but the vibration to your body parts or your nerves, tendon, ligaments will be lesser. So the injury will be done very mild. So there should be adequate rest period also. For example, if you are doing vibrating, drilling, or of any task you are performing, there should be adequate rest. You can do it for 5 to 10 minutes, give rest to yourself, and then repeat it. And then rotate the jobs. For example, if one person has done the vibration of any task, he can take break. The next colleague or the next partner can come and take up the task. So you can rotate the job as well. So in this image, I just want to explain. This person is using a designed tool, like a normal tool, which is not mechanically designed. It is leading to vibration of his whole forearm. And this is leading to a lot of stress to their joints, to the ligaments, to the tendon and nerve. Sometimes we come across people, they say we have tingling and numbness in our hand, and they don't know what's the cause behind this. So this is one of the cause that the injury is happening at your workstation. So if you see the second image, the green color one, this is the Here the person is using a mechanically designed tool which does not cause any vibration to their joints. So this is the things that they have to follow. And at the end, I just want to explain few and very important key points that you always have to remember while you are at work. Ergonomics can help you on your job, okay? So injuries can happen at your work with the risk factors. Any injury, if it happens at the workstation, this is only because there is a risk factors. So now, first of all, we have to identify what is the risk factors, and we have to reduce these risk factors. So now how we will reduce the risk factors? By reporting to our managers, to any person who is at our reporting person. We have to report and recognize that this is one of the hazard that we are facing at our workstation, and they can make ergonomic changes at your workstation and make the work and life healthy and easier. That's it. Thank you.
Thank you.
Thank you. Thank you so very much, Dr. Mujib and Ms. Gulshan, for the wonderful informative session on the most important aspect, which is normally ignored or not taken serious about the work-related orthopedic injuries. We have an important question to Dr. Mujib. Sana Muhammad Iqbal would like to know that what is the cause of cervical spondylosis and a solution for it, doctor?
Yes, again, like I mentioned on a slide on neck pain, the most common reason for the neck pain is our bad posture. Okay, so nowadays, like I mentioned before, because of the usage of mobile phone and tablets, it's very common people assume neck bent posture for prolonged hours. People will watch phone for 2 hours, 3 hours continuously, non-stop and repetitively. So that's the main reason for the cervical problem, cervicalgia, we call it, neck pain. About your question regarding cervical spondylosis, this is the late stage of the neck pain. When you have repetitively neck pain, that causes changes in your bones, in your discs, and also there are small joints in the spine, what we call facet joints. All these joints will show some changes with this repeated bad posture. Usually it does happen in people above 35, 40 years. That's what we used to study. That's what we call cervical spondylosis. But nowadays, because of the advent of these phones and tablets, we do see cervical spondylosis at much younger age. The other reason for cervical spondylosis is your genetics also. In some families, this disc degeneration is at much earlier age than the others. So it's multifactorial. Why do we get cervical spondylosis? One, your genetics. Two, your activities. So how your posture is, what's your job. If your job involves too much driving, you are likely to have cervical spondylosis. If your job involves too much bending position, like working on the computers for hours and hours, or if you are a habit of watching the tablets and phones for longer time, so you are likely to develop cervical spondylosis in very short time. So what is the treatment for it? The treatment is, again, like my colleague said, the prevention is better than the cure. So assuming proper position, avoiding bad postures is the most important thing you can do to help yourself. Apart from that one, if it is already established cervical spondylosis, then the treatment option is initially painkillers, physiotherapy to strengthen your muscles and correct your posture. Again, if your pain is traveling down the arms, whether it's a right or left upper limbs, having tingling and numbness, that means there is a pressure on the nerve. Your cervical spondylosis is causing pressure on the nerves, in which case you may have to consult doctor and they may arrange X-rays, MRI scan, and further treatment. Thank you.
All right. Thank you, doctor. And I think we are way beyond our scheduled time, actually. So there's just one more question which I would like to entertain. Iman Ibrahim would like to know, doctor, and it should attract a very brief reply. Chondromalacia, how can we adopt with it, and does it heal?
Okay. Okay, again, chondromalacia is the pain from the kneecap. So you feel pain on the anterior aspect of the knee and the front of the knee, and that's mainly because of the pain coming from the kneecap of the knee joint. So the kneecap, at the backside of the kneecap, you have a cartilage, the joint surface, and that for some reason will become softer. Okay, and it goes in mainly teenagers. For some reason, the cartilage becomes softer and painful, and again with time it becomes harder and becomes painless. So what is the specific reason? We don't know, but most of the time it's because of muscle imbalance. If you have weak quadriceps, or if your work involves too much climbing stairs or too much sitting on the floor and getting up, so these repetitive activities can lead to this chondromalacia.
Okay.
The mainstay of treatment is physiotherapy, but sometimes we can give joint supplements like collagen supplements. Thank you.
Thank you. Thank you. Doctor, Mr. Binu would like to know that what is the first aid for muscle strain, please? Before taking to a doctor, what is the first aid that we can give to an employee?
Again, depends on where the injury is and how bad is the injury is. Okay. So most of the time, if there is a specific injury, specific part like in an accident or anything, then you need to splint that limb. So if somebody has got a wrist injury or ankle injury, you try to put some temporary splint to hold it in position so that to avoid excess mobility. And at the same time, there are some painkiller sprays you can give locally, or painkiller tablets like the on-the-counter tablets like Panadol Giant or Voltaren. So those are the tablets you can give and keep the limb elevated, splinting and elevation until he reaches to the hospital. So that's what you could do it. And make sure there is no serious injuries like damage to the nerve and vessels. Make sure the patient is able to feel the fingers, able to move the toes. So just make sure the distal part is still normal. And then you can bring the patient to the nearby emergency for further treatment. So mainly, we need to keep the limb splinted, elevated, and if you have any ice application, if it is more swollen, you can give the ice application or hot pack application, then bring the patient.
Great. Thank you so very much, sir. And we have, I think, one question that Ms. Gulshan can reply to. An anonymous attendee wants to know that are posture correction devices advisable for children?
Yes, we can advise some posture correction devices for the children. For example, mostly kids at their early teen age, they develop a bad posture called scoliosis. This is like if they are not maintaining the proper posture of their spine, the spine tends to move in one side. So they can use a fixed brace to correct their posture for the spine, and other posture correction devices also for their rounded shoulders, for the spine, as well as for the feet. The kids, they can use it. It can be very helpful if you do early recognition of any wrong posture at the childhood, at the early ages, and then you give them the devices, because it will help them to develop a good posture as their age is increasing. So yes, we can give them posture correction devices for sure.
Thank you. Thank you so very much. Yes, sir.
Yeah, there are some ready-made posture correction devices which are available in the pharmacies. The most common one I would recommend is a kyphosis, rounded shoulder. Most mothers are worried that their child is very much sitting in a couched position, we call it. Yeah, so they bend forward just the way I'm sitting there. So to correct that one, we have posture correction brace, which is a very cheap brace. It's a flexible brace, can be easily applied, can be easily removed, and you can put it under your garments so that the child can maintain good posture, and hopefully that will help in strengthening his muscles also. in a right position.
And I think also like the kids, they should not be dependent completely on this posture correction devices. They can wear it to correct their posture, but at the same time, they have to work on strengthening their muscles. Sometimes it happens like they are depending on posture correction, devices and all. They don't correct they don't strengthen their muscles. So then at the later stage, then they will have issues like the muscles are weak and they have to use these devices continuously. So you use it to maintain a good posture, and then you remove it, do strengthening exercises, make your muscles stronger, and then you can wear it back again.
Yes.
Excellent, excellent, doctor. There are one or two more questions on how to prevent carpal tunnel syndrome. If you can very briefly give them a reply, sir. I think we have gone beyond the scheduled time limit. We have one more webinar to take up a little later this evening.
Yeah. I think the carpal tunnel, again, related to the posture, like Dr. Bhushan has already explained, how you can avoid wrist bending position, especially when you are doing the typing and writing. So you have to maintain good posture during your work. And if you have symptoms at night times, more tingling, numbness, there are some wrist splints, special splints, which stops your wrist going into flexion, going into bending position in the sleep. What happens is during sleep, our hands will automatically go in flexion position. So once you sleep in this position for some time, you start to develop tingling and numbness. You have to wake up in the middle of night to shake the hand. That's the carpal tunnel. So to avoid that one, there are night splints available, what we call carpal tunnel splints, which are again available in the pharmacies, and workplace adjustments to avoid wrist in bent position when you are doing typing and doing the work. So that's what will be important. Thank you.
Thank you, sir. And yes, I may disappoint some of the attendees, but however, there is a solution for everything, as Ms. Gulshan mentioned earlier. Yes, some of your questions, if you feel that you have more questions to get clarifications, you please send it to us by email and we'll get our panelists reply to you in the next couple of days. However, this entire session would be available on demand from tomorrow onwards on festival.thumbay.com website. You can watch it again and you can reach out to our panelists at the hospital. And doctor, before I conclude this session, you have many messages of thanks for the very informative session, and many of these attendees would like to thank both of you for a very informative session that you have given them and clarified many of their doubts. And yes, this brings to the end of this session on a very important issue of work-related orthopedic injuries. And I'm looking forward to meeting you all a little later on the dental hygiene tips and how to prevent and take post-operative care of the root canal treatments. See you all. Thank you very much, Dr. Mujib. Thank you, Ms. Gulshan, for this wonderful session. And on behalf of the entire organizing team of this Healthcare Summer Festival, I sign off and thank you once again.